أوتوا العلم درجات.
دكتور ماكو مشكله، كمل بس افتح التسجيل.
يرفع الله الذين آمنوا منكم والذين أوتوا العلم درجات والله بما تعملون خبير. صدق الله العظيم. زملائنا الأعزاء أطباء وطبيبات الأسنان في العراق، السلام عليكم وكل عام وأنتم بخير. أعاده الله عليكم بالصحة والسلامة وحفظكم الله من شر البلاء والوباء. أهلا وسهلا بكم في حدثنا العلمي لهذا اليوم، والذي تقيمه نقابتنا متمثلة بلجنة التعليم المستمر وبالتعاون مع جمعية طب أسنان الأطفال والوقائي، والذي يحمل عنوان Pediatric Esthetic Dentistry، يقدمه الدكتور ميليند شاه من دولة الهند، الذي يعد أحد أشهر أخصائي طب أسنان الأطفال. زملائنا الأعزاء، إن نقابتكم لم تدخر جهدا في السعي لتطوير المستوى العلمي والمهني للزملاء، وذلك يعد من صلب عملها وواجباتها، إضافة إلى واجباتها الأخرى في الدفاع عن حقوق الزملاء. ابتدأت النقابة مشوارها في التعليم المستمر منذ عدة سنوات، تقريبا منذ عام 2010، من خلال إقامة العديد من المؤتمرات الدولية والملتقيات العلمية المحلية والدورات المجانية. ولم يحل وباء كورونا دون ذلك، فقد واصلت النقابة مشوار التعليم المستمر من خلال الفضاء الإلكتروني ومنصتها الإلكترونية لإيصال المعلومة العلمية إلى كل زميل وهو في منزله. إن النقابة متمثلة بنقيبها وأعضاء مجلسها ولجنتها العلمية كان لها الشرف أن تكون صاحبة الصدى العالي في العالم في مجال التعليم الإلكتروني المستمر. شكرا لحضوركم، فالنجاح منكم وإليكم. شكرا لجميع المحاضرين الذين شاركوا في المحاضرات ولم يبخلوا بعلمهم كالشمعة المعطاء. نتمنى لكم أطيب الأوقات والاستمتاع بالمعلومات القيمة، ونعاهدكم بمواصلة المسير ولنا لكم محافل علمية أخرى. والسلام عليكم. دكتور أحمد صالح مهدي، أمين سر نقابة أطباء الأسنان في العراق.
كل الشكر إلى حضرتك دكتور، وكل الشكر إلى دعم النقابة المستمر لمجال التعليم المستمر. زملائنا، شكرا لك دكتور. زملائنا الاعزاء، حاليا راح ننتقل الى الاستاذ مساعد الدكتوره دنيا، رئيس الجمعيه العراقيه لطب اسنان الاطفال والوقائي، واللي راح تقدم المحاضر وبعدها راح نبدا بالمحاضره. Dear dentist and dental student, now we are moving to Assistant Professor Dr. Dunya Dilimi, which is the President of Iraqi Society of Pediatric Dentistry. She will introduce our speaker today, and we will start the 2 days course. I would like to notify you that there will be a registration link in which you can register, and after the 2 days of the course, there will be certificates sent to your emails. أود تنبيهكم بأننا سنقوم بنشر استمارة حضور لليومين، وبعد انتهاء الكورس سيتم إرسال شهادات المشاركة على الإيميل. الآن أترك المجال إلى الدكتورة دنيا. Now I will leave the mic to Dr. Dunya. Dr. Dunya, you can start.
السلام عليكم.
وعليكم السلام دكتورة، صوتك واضح جدا.
أهلا دكتور عبد الله. شكرا دكتور أحمد، دكتور عبد الله، شكرا جزيلا لهذا التعاون من قبل المنصة الإلكترونية للتعليم المستمر لنقابتنا العزيزة. You are most welcome, Dr. Milind. Are you hear me?
Thanks a lot, Dr. Dunya.
Thank you for your for presenting this lecture or this course. Thank you very much, Dr. Milind.
I am really grateful for Iraqi Dental Association to give me this opportunity, Doctor. Thanks a lot.
Thank you. Good evening, dear colleagues who attended this online course in pediatric dentistry. The online learning platform of the Iraqi Dental Association, and in cooperation with the Iraqi Society of Pediatric and Preventive Dentistry, have a pleasure to welcome Dr. Milind Shah from India to present this online course in pediatric dentistry. The course title is the Pediatric Aesthetic Dentistry, and it's its duration of 2 days. Today, Thursday, 22 of July, and it will be continue next Thursday on 29 of July, right, Dr. Milind?
Right.
The title of our lecture today is about the composite citric crowns. Dr. Milind Shah, MDS in pediatric dentistry, Dr. Milind graduated PDS from Mahatma Gandhi Mission Dental College and Hospital, Navy in Mumbai. He completed his master's degree MDS in pediatric dentistry from VS Dental College and Hospital, Bangalore in 2014. He has an exclusive pediatric dental private practice in Mumbai. He has received the award for Best Scientific Paper in the 35th ISPPD, Indian Society of Pediatric and Preventive Dentistry National Conference held in Jaipur. He was nominated in the category of Best Pedodontist of the Year at the FAMDent Excellence in Dentistry Award in 2015 and 16. Dr. Milind invited as guest speaker at the 39th Indian Society of Pedodontics and Preventive Dentistry Conference held in Chennai in 2017 and for a pre-conference course at 17th ISPPD Convention, Jaipur 2020. Dr. Milind authored a chapter in the textbook of pediatric dentistry by Dr. Nihal Marwa on the topic general anesthesia in pediatric dentistry. I have this textbook and it's very useful. I read most of this book, really. He was invited as a guest speaker for the CDE program on pediatric zirconia crowns in March 2018 at VS Dental College, Bangalore, and in January 2019 at Government Dental College, Indore. He regularly conducts comprehensive clinical pedodontics courses all over India. So welcome, Dr. Milind. I pronounce the name of the cities in India, right?
Right.
Okay, great. So the mic is yours, Dr. Milind. You are most welcome.
Right. So I will begin with sharing my screen.
Okay, Doctor, now you can do it. You are a co-host, so you can share screen directly.
Is the presentation visible?
Yes, it's visible, Doctor. I can see it clearly.
Right. So very good evening to all my friends. Very good evening to one and all. Let us begin with today's presentation, which would be pediatric aesthetic dentistry. So we will be covering this presentation into two halves. The first half would be more focused on composite strip crowns, and the second half of the presentation, which is going to be next week, is going to be more about pediatric zirconia crowns. So it is very important to learn about both these aesthetic options, which are very commonly used nowadays. So first, let us begin with strip crowns. So just a small introduction before beginning the presentation regarding why aesthetics is so important and why we need to treat the primary anterior teeth. What is the importance of these primary anterior teeth? As we all know that every child deserves a healthy smile, we know there are a lot of drawbacks of untreated severe early childhood caries. For example, children with early childhood caries which are untreated, probably they're going to be affected psychologically. Their overall general health could be affected. These kind of children would be, underperforming in the schools as well. They would be overall, they could be less confident. They could be malnourished. They must have, they should have vitamin deficiency. So there are a lot of drawbacks of primary, untreated severe early childhood caries. It overall decreases the self-esteem of the child. So child smile is really precious. So just imagine, once we do a smile designing case, a beautiful transformation of a child smile, how well it is going to boost their confidence and their overall performance. It could make a huge difference to these children. The day they step into the school, they should have a really good smile. So as a general dentist, most of us, have learned about, glass ionomer restorations, for any kind of direct restorations for anterior tooth. And we must also have encountered a lot of failures, you know. So I just ask a very simple question. Have you ever encountered any fractured or failed restorations, especially while treating anterior teeth? Because we are more focused on aesthetic dentistry. So I will be speaking more on anterior tooth. So yes, the answer is absolutely yes. We have encountered a lot of cases of fractured or failed restorations. There could be various reasons, you know. So the main three reasons for any fracture or failed restorations could be, the first and foremost could be the properties of the material that we are using. Whether we are using a glass ionomer restoration, or we are using a composite restoration, or we are using a compomer, or various materials, because every materials have their own advantages and disadvantages. Second could be the operator's ability. The clinical skills of the operator also matters a lot. And the third and the most important one is the behavior of the child, the cooperative ability of the child, you know, or whether we are treating the child chair side under local anesthesia, or we are treating it under a controlled environment like a sedation or general anesthesia. Because mind you, pediatric aesthetic dentistry is more focused on children who are under the age group of 3 to 4 or 5 years, and they could have little less cognitive ability. Their behavior, you know, the behavior management skills of the general dentist or the pediatric dentist matters a lot while treating this particular age group. Restorations of encountering failures when we are treating primary restoration, and most of the reasons for failure would be when we are just using a direct restoration, when we are just filling the anterior tooth. So we have a lot of literature which says that always a full coverage restoration, a full coverage crown is going to give a much stable restoration, is going to give you a much stable result as compared to just giving a direct restoration by a glass ionomer restoration, or a resin modified glass ionomer, or a composite restoration. So just looking at these pictures, can you think that these kind of cavities or these kind of severe early childhood cases could be treated just by giving a direct restoration? I mean to say, just by doing a glass ionomer filling or just a composite restoration? The answer is no, because these are multi-surface caries. As you can clearly see, either the entire labial surface, buccal surface, the proximal surfaces. So these are multi-surface caries which require a full coverage restoration. They cannot just be treated by a normal composite restoration or a direct glass ionomer restoration. So we have to think about full coverage restoration when it comes to such cases. Except for when it is just a normal class 5 restoration, we can think of a normal direct restoration. But when it comes to these kind of multi-surface cavities, we have to talk about full coverage restoration. So what is the need of full coverage restoration? A full coverage restoration is going to give you a perfect anatomic details. It is going to also help in the function, because we have to replace both the form as well as the function when we are treating a primary tooth, be it a posterior or anterior tooth. It helps to prevent micro leakage, reinfection, and does not allow any secondary decay if we are giving a full coverage.
Dr. Milind, sorry for interrupting. Doctor, I'm receiving message. Can you please explain slower, because there's kind of interrupt.
Okay, you want me to speak a little slow?
Yes, slower, Doctor.
Okay, right, all right. So what is the need for full coverage restoration? First of all, we have to give proper anatomic details to the tooth, be it a posterior tooth or an anterior tooth. Also, we have to replace the function of the tooth. So replacing form as well as function, both are equally important when we are treating a primary tooth. And giving a full coverage restoration is also going to prevent micro leakage and reinfection. And it won't allow any secondary decay to happen, which would be a cause of failure. Because secondary decay is one of the most important cause of failure of any restoration. So overall, giving a full coverage restoration is going to improve the prognosis of the tooth as well, because we are giving a stable restoration which is going to last for many years. Now coming to what are the objectives of restoring anterior teeth. First and foremost, it helps in mastication, because anterior tooth are very important for chewing and biting. And most commonly, most important is that it also helps to improve the aesthetics and the overall confidence and self-esteem of the child. The third reason, the objective for restoring the anterior tooth, it helps in the phonetics, because anterior teeth helps the child to develop a proper speech. Without anterior tooth, or when there is some missing anterior primary incisors, a lot of words the child will not be able to speak properly. Anterior tooth also helps in space maintenance, especially when the primary canines have not erupted. It helps to prevent aberrant habits. Without anterior tooth, there could be chances of tongue thrusting. So it helps to prevent a lot of oral habits. So overall, the conclusion is that anterior teeth are very important, and restoring them, it helps a lot for the overall growth and development of the child. So coming to what are the different options of restoring the primary anterior teeth. Now there are a lot of options when we talk about literature, but the most commonly used restorations in my clinical practice and overall is nowadays we only use either strip crowns or we use preformed zirconia crowns to restore any kind of anterior tooth which are having multi-surface cavity. So it is either the strip crowns or the preformed zirconia crown. So these are the two most commonly used restorations in our day-to-day practice, because they give a full coverage restoration and they provide a very long-lasting restoration as compared to giving just a normal direct glass ionomer or a composite restoration. So today's lecture would be more focused on composite strip crowns. Also, there is one more option which was used in the earlier days, but now it is outdated, which is a stainless steel open-faced crowns. Now these crowns are sturdy and stable enough, but the aesthetics of these crowns is not good. So nowadays, since we have got better options like strip crowns and zirconia crowns, it is the more preferred options in our private practice nowadays. Am I clear, Dr. Abdullah, now?
Yes, doctor, yes. But just can you please speak louder? Can you make the mic near you?
Right. Oh. Okay. So we will start talking about strip crowns. So what are strip crowns basically? So these are plastic kind of celluloid kind of crowns which are specially made for primary incisors to produce a mouth form, direct and a full coverage composite resin restoration. So these are basically preformed plastic form of crowns. The composite strip crowns are one of the most aesthetic restorations which are available to the clinician nowadays for the treatment of severely decayed primary incisors. Is my voice clear now, Dr. Abdullah?
Yes, clear. It's clear, doctor.
Okay. So strip crowns, what currently I use in my practice is the 3M company of strip crowns, because these crowns are very sturdy with a very good anatomic details. And I can say that one of the best strip crowns which are currently available. So it comes in a kit and it is available only for maxillary incisors. It is available only for maxillary central and maxillary lateral incisors. It comes in 4 sizes, basically size 1, 2, 3, and 4. So it comes as upper lateral, upper centrals, and upper laterals both, right side and left side. It comes in size 1 to 4, out of which 1 and 4 are the extreme sizes. And most commonly used sizes for strip crowns are size 2 and size 3. So as you can see in the image clearly, so these are the crowns, and it comes with a very short handle. It is called as a collar. So this is the handle which comes along with the crown. So to just hold the crown properly. Now 3M company crowns, these are not available for canines, but if we have if we have to restore a canine, a primary maxillary canine, then there's one company which comes by the name of Kids Crown. So this they provide us with canine strip crowns as well. But most commonly, the maxillary centrals and maxillary lateral incisors are to be done. So the crowns also it comes in apart from the kit, it is also available as the refills also. So as and when we need refills of the crowns, we can use and we can refill our kit. Now, what are the advantages of these strip crowns? These are very simple to fit and trim because these are just plastic form of crowns. The removal is also very fast and easy. It easily matches the natural dentition. It's going to leave a smooth and a shiny surface. And in most of the cases, it does not require any kind of a polishing as well, because the surface after you do the strip crown appears very glossy and absolutely polished surface. So you don't have to do any kind of polishing after placing these strip crowns. Easy shade control with composite, which is the biggest advantage of these strip crowns, because you can select the shade of the composite which can exactly match the tooth structure. So this gives an advantage. It has got superior aesthetic quality because of these reasons, and it has got a large selection of size. As I told, it comes from size 1 to size 4. So whichever size is going to fit that particular case, you can select that size. Now coming to the most important part of the presentation. So this is the step-by-step procedure of the strip crowns. First and foremost, if you are doing any kind of a pulp therapy, then you have to give a local anesthesia. Otherwise, just for placement of strip crowns, you do not need any kind of local anesthesia. It can be just done directly. The second step is to select the crown. Now, how do you select the size of the strip crown? So before starting the preparation, you just have to hold the strip crown and compare the mesiodistal width of the strip crown with the tooth. So this is how in the image, as you can see, how they are comparing. So you can select either size 1, 2, 3, or 4, depending upon how the mesiodistal width of the crown is. So you can just hold the crown with the collar, and you can just compare the mesiodistal width of the crown. So this is how you select the crown, which is the second step. Now next comes the preparation. Now for strip crowns, you do not need any kind of a special tooth preparation. You just have to excavate the caries, and you have to do some proximal preparation if there is no proximal spacing between the primary incisors. Now in most of the cases, there are primate spaces in primary incisors, so you do not have to do much of a proximal reduction. You may just do a very little proximal reduction so that the crown fits inside. So overall, you just have to do a very minimal reduction. You do not have to do any buccal or lingual preparation, especially for strip crowns. You just have to excavate the caries which is present on the buccal or the proximal or lingual palatal surfaces. So that is the second step. So the first step was to select the crown, and the second step is to do a very minimal reduction. So the reduction is more focused on the proximal preparation. Now, once you've selected the size, then third step is you have to trim the crown with the help of a scissor. So with the help of a scissor, you just have to cut the collar, the one which you have used to hold the crown. You have to trim that collar of the crown. After you've cut the collar of the crown, you have to seat the crown, and you have to check whether the crown is fitting properly or no. As you can see clearly in the image, how the crowns are being seated. So you have to cut the collar of the crown, and you also have to cut some of the cervical part of the crown also, because as you can see, the length of the crown is slightly more. So depending upon the length of the tooth, you may have to cut little cervical part of the strip crown as well. And you can see in the image how the crowns are being seated. So you can see the crown has to go at least 0.5 millimeters subgingivally all the surfaces, buccal, lingual, and proximal surfaces, and the tooth surface should not be exposed. So as you can see in the image, this is how you check the fit of the crown. Now the next step is to create some vent holes in the strip crowns. So because the basic concept of strip crowns is you just have to load the crowns with composite, you have to fix it on the tooth, and then you have to cure it, and towards the end you have to cut the crowns. That is why the name of the crown is strip crown, because you are stripping off the crowns towards the end. So when we fill the crown with composite and when we load the crown on the tooth, there should be some space for the excess composite to come out, which is why this step is very important to make vent holes. Now, as you can see in the image where they have made the vent hole, so this is the most common area where we create a vent hole. You can make it on the either on the mesio-incisal edge, or you can make it on the disto-incisal edge with the help of a very sharp. You can make it with the help of a very sharp curved probe, or you can make it with the help of a round burr as well. The other common site of creating vent hole is also on the palatal surface. So sometimes I prefer to create vent holes on the palatal aspect of the crown. So you just have to create one vent hole from where the excess composite can come out. So this was the second step. Now the next, so now the next step is to fill the composite resin inside the crown. So as you can see in the image, how they have filled the crown with the help of a composite resin. So we have to use a packable composite over here. We do not have to use a flowable composite. We are using a packable composite. And next comes to etch and bond the surface of the tooth. As you do a normal composite restoration, you just have to follow the same steps now. You have to etch the tooth surface on all the four sides, and then you have to bond and you have to cure it, right? On the other hand, your strip crown with the composite loaded is already ready. So the next step now is to place the crown. The crown which is containing composite is firmly seated onto the prepared tooth. So as you can see in the image, this is how we are placing the strip crown on the prepared tooth. And towards the end comes the last step, which is to strip off the crown. These are plastic crowns and they are very easy to cut. That is why the name is strip crown. So how do you cut this crown? You can either cut with the help of a very sharp spoon excavator, or you can cut it with the help of a small blade. You can give a very small cut either on the incisal edge, or you can cut on the lingual surface. So once you create a small cut, the entire strip crown can be easily teared off. So you have to strip the crown. And towards the end, in most of the cases, as we have discussed, it does not require any kind of polishing or smoothing, because it naturally gives you a very polished and glossy and a shiny surface. So this is how it looks after you have cut the strip crowns. So this image is just to show you how the crown looks after you have cut the collar of the crown, right? So you just have to cut the collar of the crown, that is the handle of the crown, and you also have to cut slight, maybe 2 millimeters or 3 millimeters of the cervical part of the crown as well. Otherwise, the crown would be too long. So as you can clearly see over here, how they are cutting the crown, right? So apart from the handle, they are also cutting some part of the cervical part of the crown as well, because otherwise the crown would be too long and the tooth is going to look very much big. That is why you have to cut depending upon the size of the tooth. So this is just a small summary of the step-by-step preparation that I have just discussed now. Is to first select the crown. This is how you select the size of the strip crown. You have to load the crown with the help of composite. You have to place the crown over the tooth. And towards the end, with the help of a small blade, you can just cut the crown and you can tear it away. And this is the final picture, how it looks after you have stripped off the strip crown. So this is basically a very easy technique, giving you a very stable result. And most importantly, since it is a full coverage restoration, the chances of these kind of restoration lasting longer is more as compared to direct restorations by glass ionomer or composite. Now coming to some of my case presentations, so we'll just show you clinically how it looks like with a lot of follow-up cases. So just to clear one more thing, since we are treating primary anterior tooth, the age group of the children could be between 2.5 to 4.5 year old. We have to focus towards a follow-up of approximately 3 years, because that is the average time that these anterior tooth are going to last. So you have to keep in mind that minimum 3 years you need to keep these restorations stable in the oral cavity. You are not looking at a 7, 8, or 9 year follow-up of these cases. You just have to look at 3 year, probably to the max 4 years in most of the cases. So coming to one particular case, so this was the child who was presented with a severe early childhood caries, and as you can clearly see, the kind of caries that he's having. These are not soft caries, which are multi-surface. As you can see, the buccal surface, the cervical surface, even the proximal surface, and some amount of lingual surface is also involved. So these are called multi-surface cavities, and it is these are ideal cases for any kind of full coverage restorations. So in the first visit, I had placed strip crowns with both the central incisors. This procedure was done chair side without any kind of sedation or general anesthesia. So the next visit, I had planned to do strip crowns with both the lateral incisors. So as you can see, this is the step wherein I have placed the strip crowns, and I have just checked the fit of the crown. Then you have to fill the crowns with composite, as you can see in the image. Next step is to prepare the tooth, is to make the tooth ready for bonding. So you just have to do the etching, you rinse it, and then you do bonding and you cure it, followed by placing the strip crowns. And as you can see in the image, you just have to cure the crowns from both the surface, buccal and lingual, after you have placed the crowns. And towards the end, with the help of a blade, you can give a small cut and you can tear the strip crowns. So this cut can be given on the labial surface or on the incisal surface, or best would be to give a cut on the palatal surface of the crowns. So this is how the crown, all the 4 crowns looks like. So if you can see the pre-op image of the child, and if you can see the post-op image, so how you can see the transformation which is being given to this child, and now you can imagine what could be the level of self-confidence of this child once he has got a different smile altogether. So this was a 2.5-year-old, 2.5-year follow-up of this particular case, wherein you can see one of the central incisor has been exfoliated, probably due to any reason. But overall, the case, the crowns are stable with some amount of stainings and all that, which is common with strip crowns. So towards the end of the procedure, we are going to discuss some of the drawbacks of strip crowns as well. In some cases, it does not require any kind of pulp therapy as well. So it depends upon the extent of the caries, whether root canal is required or no. In most of the cases where the cavity is not involving the pulp, you do not have to do any kind of pulpal procedure. You can just excavate the caries and you can place the strip crowns. So this is to show you how, after placing the strip crowns, and how you check the fit of the crown. As you can see, some amount of blanching on the gingiva. This is because the crown goes subgingivally. Once the crown grows subgingivally, the fit of the crown is proper, and you get a nice retention with the help of these crowns. So they should not be loosely fitting. The crown should give you some resistance when you fit it on the tooth surface. Discussing one of the case which was done under general anesthesia. So this was the pre-operative image of the child. He was a very young child, probably even less than 3 years maybe. So as you can see, all 4 central incisors are having multi-surface cavities. So we did a pulp therapy and we planned strip crowns for this particular case. So this is how we have checked the fit of all the 4 strip crowns. Then comes the procedure of etching and bonding the tooth. And towards the end, you place the strip crowns and you cure it and you cut the crown. So this was the post-operative, this was the immediate post-op image of this particular case, where you can see we have not done any kind of polishing or smoothing. And you can see how glossy and shiny the strip crowns look immediately after you remove it. So that is the main advantage of these strip crowns. Apart from being stable, aesthetically as well, they give you a very nice appearance because it gives an absolutely perfect glossy appearance in the immediate post-op image when you can see. This is one case where this is a 34, this is close to 3-year-old follow-up with a particular case wherein no pulp therapy was done because the caries were not involving pulp. So as you can see the last image, this is the 34 month follow-up of the strip crowns. As you can appreciate how stable these crowns are. I cannot be sure if by just doing a direct glass ionomer or a composite restoration, these crowns, the restoration would last for such a long period of time. So of course it requires these kind of full coverage restoration to get a long-term success. This particular case, wherein again you can see child suffering from severe early childhood caries, age approximately 3 years with multi-surface caries. So as you can see in the pre-op image, and this is the post-operative. After I have done both the central incisors, the next I have planned both the lateral incisors. So you can see this is the position of the strip crowns to just check the fit of the crown, and then you can see this is the final appearance. So how beautiful these strip crowns look. So you can just compare the pre-operative and the post-operative image, and you can see how aesthetically pleasing. I cannot give this kind of aesthetics with the help of a glass ionomer or a resin modified glass ionomer or even a direct composite restoration, because either those kind of restorations will chip off or get fractured easily, or they cannot be as aesthetically pleasing as these kind of strip crowns. So this is the best advantage of strip crowns, that apart from being economical, cost effective, it is easy to place, and it does not involve a lot of steps, and you can witness the aesthetic appearance of these crowns. Does not require any kind of special polishing as well. Again, one particular case wherein you can clearly see this was a 3-year-old child with severe early childhood caries, and all 4 central incisors were pulpally involved. So we did pulpectomy followed by strip crowns. So this is very simple to do, and it gives a very nice aesthetic outcome as well. This is one particular case where no pulp therapy was required. We just did some caries excavation and we placed the strip crowns, and you can see the post-operative image, how good it looks and how the smile of the child has been transformed. This is one particular case where the child was 3.5 years old, and we have been following it up this case. So as you can see, a 26-month-old follow-up of this case, where you can see how stable these strip crowns look. Because as you can see in the pre-operative image, the cavity is on the buccal surface as well as on the proximal surface. So it comes under the category of multi-surface restorations. So we have selected a full coverage restoration for this particular case. And you can see a 26-month follow-up wherein the crowns are still looking aesthetically good and they are stable in the child's oral cavity as well. So a lot of similar cases, and as you can see in the radiograph as well, this particular case where all 4 incisors were pulpally involved, the pulp therapy was done, it was obturated with Metapex, and we have done the strip crowns, all 4 strip crowns in the single visit. So you can see the smile of the child, how we have transformed the particular smile and how beneficial it could be for the future of this child. Now this is a short video on a model to just show you the step-by-step procedure, so how we have placed, how we do perform the strip crown. So this is on a model where I am going to place a lateral strip crown, lateral incisor. So just have a look. So after you select the size of the crown, you have to trim the crown. If the crown does not fit inside properly, you may have to trim the cervical part of the crown a little more. So I am making vent hole on the palatal aspect of the crown. You can also make it on the nuclear incisal or the distal incisal edge of the crown. Now we have to fill the crown with composite. So once you have prepared the strip crown and you have loaded it with composite, now we can etch and bond the tooth surface. So you remove the excess composite which has come out of the vent holes. And then you have to cure the crown. step is to cut the strip crown. You just give a small cut with the help of blade on the incisal surface, and this is how the crown will come out in toto, leaving behind a shiny and a glossy surface. So that was a video on a demo, and this one small video which is there on a just performed on a patient, just to see how we place the crown and how we cut the strip crown towards the end. This was a non-vital tooth which was affected by trauma. Making a cut on the incisal edge, and a small cut on the labial or the lingual edge. So that was a small demonstration on the patient. So till now we have mostly spoken about what are the benefits of strip crown. But as we know that there are two sides of a same coin, likewise there are going to be a lot of drawbacks as well of these strip crowns. So what are the most common disadvantages of strip crowns? However, strip crowns are technique sensitive. Moisture contamination with blood or saliva can interfere with the bonding procedure, and hemorrhage or bleeding can alter the shade or color of the composite. So these are the main drawbacks of strip crown. Also, it can be easily fractured by trauma or traumatic occlusion, and it needs adequate tooth structure. I mean, it needs adequate enamel for proper retention and bonding. And also, the most common thing is that it requires a lot of patient cooperation as well. So if we are doing it chair side, then you're going to need a lot of, you're going to need excellent cooperation from the child, because it involves a bonding procedure which is slightly technique sensitive as compared to a rooting process. So these are the main drawbacks of the strip crown. You have to give proper instructions to the parents as well, that you cannot chew anything which is very hard from the front tooth. because it can lead to fracture because of any trauma or these kind of incidents. And this image clearly shows that because of hemorrhage, there could be there could be differences in the shade, and it can alter the color of the crown. So you might not get absolutely perfect shade match, because this is going to affect the bonding of the composite. So there should not be any kind of you should be able to control the bleeding properly. And one more drawback of strip crowns, as you can see in the image, over the years, what we have seen is that the color of these crowns, they can become little yellowish. So the aesthetic quality of strip crowns is going to decrease over a period of time. It may not be as aesthetic, as shiny, as glossy as it was, during the immediate post-operative phase. Maybe after 1 year, after 2 years, or after 3 years, as you can see in the image, how yellowish the crowns can become. Of course, it also depends upon the maintenance by the patient as well. But in general, the aesthetic quality of strip crowns decreases over a period of time. It depends upon number of factors. Also, in this particular image, as you can see, in the 3-year follow-up of the child, as you can see, some amount of fracture as well. So this is, the chipped surface or fracture. So strip crowns can fracture as well, apart from the aesthetic quality of strip crown decreasing over a period of time. So what I generally tell to my parents before suggesting them this option, of course, this is a cost-effective option as compared to pediatric zirconia crowns. But what I always tell to my parents before placing strip crowns is that whenever you see such kind of oral cavity, as we have seen in all my case presentations, I tell to the parents is that in such an oral cavity, you imagine that if it was difficult for the enamel to survive in that oral cavity, then imagine how difficult it would be for a composite to survive in such a oral cavity. So of course, it requires a lot of maintenance from the patient. It requires a lot of care, regular follow-up by the patient as well. Because if the enamel couldn't survive in the oral cavity of your child, then it will be difficult for the composite also to survive in the oral cavity. So as you can see in the image, how the aesthetic quality has decreased, and how some amount of, you can see fractured or chipped surfaces, because the child does not maintain properly, then this could be, in the follow-up, you can see such kind of images. So these are the main drawbacks of strip crown, which is the reason why there is an alternative nowadays, which is being advised for many of our patients who come with, grossly destructed primary anteriors. We give them a alternative option. So because of these drawbacks of strip crowns, there is an alternative which we are going to discuss, a very interesting topic, and a very latest material, which is a pediatric preformed zirconia crowns, which is of higher aesthetic value as compared to strip crown, with better compressive strength, with better properties as compared to strip crowns, and less technique sensitive as well. So towards the end of the presentation, I would just like to ask one question, that what does the phrase best restoration mean? So which restoration is going to qualify as a best restoration as per you? Is it the most durable restoration which is going to be the best restoration? Or which is the most conservative restoration? Which one is the least technique sensitive? Or which one is the most aesthetic? Now, if you want me to answer these 4 questions, I would probably require 4 different kind of crowns to fulfill the properties, because not a single crown is going to fulfill all these criteria. If we talk about strip crowns, it may not be the most durable restoration. Yes, it could be a conservative crown, but is it the least technique sensitive? No, zirconia crowns are even less technique sensitive. But are zirconia crowns conservative? No. So each and every crown is going to have its advantage and disadvantage. A different restorative option might be suggested for any of these 4 questions, is what I mean to say. But towards the end, always remember that if you can see the tooth crown, you save it. If you can't, then you just have to let it go. So if you can just see, even two tooth, but if I see no enamel which is visible clinically, then it is better for me to extract and give a Groper's appliance or replace the primary anterior tooth. So adequate tooth structure is what is most important for longevity of any kind of direct or a full coverage restoration. So thanks a lot, my colleagues. Thanks a lot, Iraqi Dental Association, for giving me this particular opportunity to share my experience regarding pediatric strip crowns with you. Thanks a lot. Thank you very much. So you can always reach out to me if you have any particular query regarding strip crown. And towards the next presentation next week, it would be a much more interesting topic of zirconia crowns with a lot of videos as well. Thank you very much.
Thank you so much. Thank you so much, Doctor. Doctor, if you have a few minutes, we have received a number of questions. Can you please answer it for today?
Yes.
Okay, I'm gonna go for the starts for now. We have Doctor. First question is, Doctor, how do you control gingival bleeding and sulcus fluid?
So gingival bleeding can be controlled by two most common means. First is either to press it with a moist cotton. The cotton can be dipped in local anesthesia as well. So a lignocaine with adrenaline solution, you are dipping a cotton in that solution and you can just compress it on the tooth for 2 minutes and it is going to control the bleeding. Or you can use any kind of bleeding controlling agent which contains aluminum chloride, which contains 25% aluminum chloride to control the bleeding. So you just have to control bleeding either with the pressure with the cotton or using any kind of gel which contains aluminum chloride to control bleeding.
Okay, Doctor, we have another question, which is from Dr. Muhammad. Dr. Muhammad is asking, can we use the celluloid crown for adults too?
These 3M strip crowns, as far as I know, is only for pediatric, but there are strip crowns available for adults as well. I'm not sure about the company, but these particular crowns are only for pediatric. But yes, the answer is yes. For adults also, I have seen that there are strip crowns available.
Okay, Doctor, I have another question, which is from Dr. Sarah. She's asking, how much the crown should enter subgingivally?
It should be 0.5 millimeters, 0.5 millimeters. The main purpose is that the tooth surface should not be exposed. So even if you go just a very little subgingivally, that is even 0.5 millimeter subgingivally is also okay. So 0.5 to 1 millimeter subgingivally is the answer of the question. So that much is enough. You don't have to go more subgingival.
Okay, Doctor. Another question is, which is from Dr. Misbah. He's asking, how can you deal with the gingival inflammation due to the over-contoured margins after placements?
See, you have to cut the strip crowns properly. If you are cutting the crown properly from the cervical part, then the crown will not go more subgingival inside. If the crown goes more than 2 millimeters subgingivally, then there will be some amount of gingival inflammation. But the beauty of pediatric periodontium and pediatric gingiva is that any amount of gingival inflammation is going to get corrected within a week. So just after 1 week, if you observe the patient, you are going to see excellent gingival healing and the gingival inflammation will be solved. So in the next presentation in the next week, you can see the zirconia crowns which go around 2 millimeters deep subgingivally, which causes a lot of gingival inflammation on the immediate post-operative visit. But just within 1 week and 10 days, you can see how well the gingiva heals. That is the beauty of the healing of gingival, pediatric gingiva.
We have another question, Doctor, which is from Dr. Mushtaq. He is asking you, what is the proper type of composite that you prefer? What's the proper type of composite that you prefer, your personal?
You can use any packable composite. So I generally use the Filtech 3M Filtech 350 composite. you can use any composite of Ivoclar. It should be a packable composite, is what I mean to say. No flowable composite, only a packable kind of composite you can use for strip crowns.
Doctor, we have another question, which is from Dr. Bayda Rawi. Dr. Bayda is asking, Doctor, how can we maintain the great work like yours by the composite full coverage? How can you prevent the child from biting sticky hard candy, for example, and prevent biting an apple? Because in my same work, the failure was because the child has hard food biting.
Yeah, so this is a very nice question. So always before the beginning of strip crowns, all the parents will be going to ask me that how long is the crown going to last. So you always have to give them the proper instructions that you don't have to bite anything which is very hard. If you are biting an apple or a very hard fruit, then you have to give them the instruction that you have to cut the apple and then you have to eat. You don't have to bite it directly, because what is the most important factor is that if in the pre-operative stage, if the amount of tooth structure which is remaining is very less, then there are very high chances of the strip crown getting fractured. But if you have got a very adequate tooth structure before you start the procedure, then the chances of strip crowns lasting longer is going to be much high. So what generally nowadays I prefer when the crown is grossly decayed, so zirconia crowns, P-form zirconia crowns are a better choice as compared to strip crowns in cases where the crowns are grossly destructed. So you just have to advise the parents that you don't have to bite anything very hard, because that is a drawback of strip crowns.
Okay, Doctor, another question is from Dr. Reem. She is asking, why don't you use rubber dam?
You can you can use rubber dam as well, because composite restoration again is a technique sensitive restoration. It all depends upon again the behavior of the child. As I said during the start of the presentation, that these kind of procedures generally done for children who are less than probably 2.5, 3 year, 3.5-year-old, maximum 4-year-old child. So you need a lot of cooperation from these particular age group. So whenever it is a controlled environment like sedation or a general anesthesia, I will prefer to use rubber dam. Otherwise, it depends upon the cooperation of the child, whether we can use it in all cases or no. So it depends upon the behavior, the cooperation of the child as well.
Doctor, another question, which is, Doctor, which is the best one to use, conventional glass ionomer or LifeSecure resin modified glass ionomer?
For strip crowns, we are not using glass ionomer restorations. At the maxi, we are using composite, or we can use Equiafort type of glass ionomer restoration as well. But if the question is regarding the posterior fillings or class 1 restorations, then I would suggest a light cured glass ionomer cement is a better option. But for strip crowns, composite filling is a much better alternative.
Okay, Doctor, now we are in with the questions. Now I will leave the mic to Dr. دنيا. زملائنا الأعزاء، في نهاية اليوم الأول أترك المجال إلى شركائنا في هذا الحدث، الجمعية العراقية لطب أسنان الأطفال والوقائي، ممثلة بالأستاذ مساعد الدكتورة دنيا الدليمي، لكلمة الختام وإنهاء هذا اليوم، على أمل أن نلتقيكم إن شاء الله في اليوم الثاني من هذا الكورس، والذي سيكون إن شاء الله يوم الخميس القادم، وسيتم الإعلان عن التفاصيل من خلال صفحة المكتب الإعلامي نقابة أطباء الأسنان في العراق. أما بخصوص شهادة المشاركة يتم توزيعها بعد اليوم الثاني، يعني المشارك يجب أن يحضر يومين حتى يتم إرسال الشهادة عبر الإيميل له إن شاء الله بعد نهاية اليوم الثاني اللي هو راح يكون يوم الخميس القادم. الآن أترك المايك إلى الأستاذة الدكتورة دنيا الدليمي. تفضلي دكتورة.
Well, thank you, Dr. Milind, for this informative lecture. Thank you for all the information that you gave to us. Hope to see you next week on Thursday to continue this interesting topic. Thank you very much, Dr. Milind. Thank you, all of you, my colleague. Thank you very much.
Thank you so much, Dr. Dunya. Our friends are asking about the second day. It will be posted in the page of Iraqi Dental Association. زملائنا الأعزاء، من يستفسر سيتم نشر معلومات اليوم الثاني واللي راح يكون يوم الخميس القادم الساعة 9 مساء بتوقيت بغداد على صفحة المكتب الإعلامي لنقابة أطباء الأسنان بالعراق. ان شاء الله. حاليا راح يتم انهاء هذا الميتينج ونلتقيكم ان شاء الله في يوم الخميس.
شكرا لكل الحضور، شكرا لك دكتور عبد الله على هذا الجهد، شكرا جزيلا.
شكرا جزيلا لكم. Thank you so much our participant and thank you Dr. Milind. See you next Thursday. Have a nice day all. Good night.
Thank you very much. Thank you.